welcome back to Reclaiming Fertility Joy, Healing the Broken Spirit of Polycystic Ovarian Syndrome. I am your host, Corey Ray Kovacs, registered nurse and women's wellness mentor and educator, and I am here with the most amazing, beautiful human being today. This is Haley Miskowiec. She is a registered dietitian who has been working with women before, during, and after pregnancy for over 8 years. She is on a mission to help women have healthy, feel-good pregnancy journeys. She has assisted hundreds of women to break free from outdated, overwhelming, and conflicting nutrition information to have confident pregnancies. She will help you minimize your pregnancy symptoms, gain energy, and feel confident that you are getting the nutrients you need to support the growth and development of your baby. Well, welcome, Haley. We're so happy to have you here on the show.
Thank you, Corey. Excited to be here.
This has really been an amazing journey, just kind of seeing all of these amazing people come together to provide service and support to those that are going through the fertility journey and maybe having difficulty, especially with polycystic ovarian syndrome. And so I know when I connected with you, seeing the amazing way that you connect with your audience was fantastic. So I would love to hear a little bit more about your mission to support women through the entire fertility and pregnancy process and their journey.
Yeah, well, gosh, the mission started a long time ago, as you mentioned in my bio. And really, at the end of the day, it became like a personal passion as well when I started my own journey and just realized that I knew so much about pregnancy, but I was really lost when it came to what I needed to do to prepare my body. And we have so much research that shows how important that preconception space of
Wow.
your nutrition is, just to really support the long-term health of baby, the long-term health of a mama, and everything like that, just to really decrease those complications that happen during pregnancy. We actually have the most impact and influence during that preconception journey. And so I knew that I needed to figure out what I needed to do to maximize that space. But I, of course, like as I started my research, as many people I'm sure can relate to, went down like a deep, dark hole in this space because, of course, I was left with my doctor, which I love my doctor and everything like
Hey.
that. But I was really left in like the dark when I was coming off of birth control, knew I needed to get off sooner than what was recommended. But my provider was like, "Oh, you're healthy. You just need to get off your birth control for 1 month, have a cycle, and you'll be good to go and you can start trying." And it just sounded too good to be true. You know, sometimes when you hear those things, you go, wait, there's more to this. Like there has to be. First off, I was on birth control for 14 years. I couldn't even tell you what my cycle looked like. And so then, of course, in my mind, wondering what could possibly come from my cycle. How was I supposed to know when I was ovulating? All that great stuff. And so just feeling like overwhelmed, confused, conflicted with all the information that was out there. You can ask my husband. I had a little bit of a meltdown of just
Oh,
going, what are like, we should have started doing this a long time ago. What are we going to do? You know, just all these things until it just kind of dawned upon me going, wait, like you've learned the pregnancy world, Haley. Let's just learn this space and do the research in it.
mhm.
And so I dived into it and I've also had friends and now clients who have all went through that very similar experience as well, and just really wanting to take that away and help women walk in to this chapter of their life that is supposed to be such a significant, fun, enjoyable chapter that we're told majority of our life until we're kind of getting close to that chapter.
Right.
um to actually go in feeling confident versus going in going, oh no, like what do I do now? I don't
Right.
get to see my doctor for 8 to 10 weeks, if not longer than that. Like, what do I do? Right. So just really wanting to make women feel confident and empowered and at the same time thrive during this space so that way they can feel good and enjoy their journey versus like trying to navigate all the different spaces. So That's really what my mission is for women to just really feel that way and feel like they're in the driver's seat.
Yeah.
They're making the decisions and they're like the biggest advocate and they feel powerful when they're talking with their provider on what decision they do want to make. So, yeah.
That's such an important piece. Yeah, I mean, it's so huge because I feel like we kind of have this, I don't know, it's like kind of this Disney princess mindset of like, oh, we're going to, we grew up in this age where birth control was the mainstay. That was what you did, when you became sexually active or even for healthcare reasons, especially if you were diagnosed with things like PCOS when you
Hmm.
were a teenager, and then they're like, oh, yeah, it'll be fine. There's no side effects, and this stuff. And of course, we know that that's not entirely true
Hmm.
now, right? We've got so much emerging research because now we have a significant amount of us who were on birth control for 10, 15 years. And then we're like, okay, now we want to start a family. And like you said, you're like, oh, yeah, maybe a month or so. And then you can start trying. And maybe that happens for some people. I mean, anecdotally, I've heard more of the opposite, in
Hmm.
terms of that. So you come into this like with this idea of what it's going to be like, and then it can be really devastating and really take a blow out of the excitement of it, the romance of it, the kind of magic of conception and
Hmm.
starting a family when you get hit with, some complications. Maybe you don't start your cycle right away. Maybe you get a PCOS diagnosis or another kind of diagnosis that affects your fertility, or maybe it just takes a while. We know that it can take up to 2 years to do that, to
Hmm.
start a cycle after the pill. And that can really, like you said, affect your planning, right? You're like, when we should have started a lot earlier. And
Hmm.
so I love that you're working with women to really kind of bring this power back to them in a time that can feel very um disempowering, from a healthcare standpoint, for sure. So
Yeah.
what do you so what's kind of like the first steps when you have somebody that comes to you and maybe they're in the beginning stages and they have a diagnosis with PCOS or some other unexplained fertility? What's kind of the first steps that you take when you start working with clients for to help improve their fertility?
Yeah, so multiple things. It's really, getting like that intake, like looking at their medical history, seeing what's going on, doing a little bit of a recall of like what have you already done, right? There's not many clients that I start with who haven't tried doing things on their own, right? Or have been led a certain way by their healthcare practitioner or multiple practitioners, because some of us do have OBs and then our primary, and then we might be seeing a fertility specialist as well and getting many different answers from each provider. So really just figuring out what have you already tried? Where are you? What are you tracking? What are you not tracking when it comes to your cycle, right? Because there's a lot of things too that I find with misinformation on what is the most important markers to be tracking of your cycle too. So really talking about that, looking like diving deeper, so looking at one, we want to look at supplementation, like, because a lot of times people are given like lists of supplements to take, but then when I ask like, okay, so why did your provider put you on this, there's usually not an answer. And so at the same time too, when I'm looking through the lab work that has been done, the lab work that would sync up in my registered dietitian
Right.
brain of why we would have someone on a certain supplement isn't there, right? And so then it's kind of going back to the drawing board and going, okay, we need to pull some of these labs. We need to revamp your supplementation to really look at to really target what's going on. And at the same time, we like looking at your diet, right? Like, how does your diet look? How does your lifestyle look? What's going on, right? Because with PCOS, one, we know there's multiple different, like, I like to call them subtypes of PCOS,
Sure.
and that impacts like what we're targeting to. Like, are you dealing with inflammatory PCOS? Are we dealing with insulin resistant? We can't just assume because I think it's 70% of women with PCOS have
Mhm.
insulin resistant
Yeah.
PCOS, that that's the reason, right? Because
Right.
we also have inflammatory, we have post pill. And so just thinking and really getting into like looking at the lab work that would show us which one is it, that is most likely causing it? Like, are we looking at your adrenals and they're having issues? Are we looking at, your insulin resistant systems? Are we looking at your liver, your kidneys, those, your blood sugar control?
Mhm.
But all of that also does tie back to our diet. Like, how are you eating throughout the day? How are you managing stress? How are you moving your body, right? All those things impact how our body um is feeling, right? Like, one of the biggest things I think we forget is that when our body does not feel safe
Right.
like, if our body does not feel safe and that it does not have the resources it needs, it's going to shut down our reproductive system. That's the
Exactly.
first thing our body does, right? Like, our bodies are made to survive. And so, it's going to go, okay, well, I got to take care of you. So I'm shutting down your reproductive system because this is not a priority for us to have if we can't keep you functioning with the resources we need. And a lot of times, what I find is a lot of misinformation on how to be managing PCOS that also leads into caloric deficits, leads into increased inflammation because we're not fueling the body properly because we are in a caloric deficit, or we have nutrient deficiencies because we're told to take out certain food groups. So it's really trying to come in and wipe the slate clean and say, okay, what is actually going on here? And now let's develop a plan for what we're actually seeing, right? Like, the facts. What are the facts for us to
Mhm.
build off of? And at the same time, meeting women with where they're at, right? A
Right.
lot of times, a plan is going to have a lot of different steps we need to take, but we also need to take them in a realistic, sustainable way
Mhm.
for it to be realistic for lifestyles. We're all busy.
Right.
We've all got jobs. We've all got these things going on. And so prioritizing those steps as well to say, okay, like, let's get this taken care of, and then, like, let's walk up these steps together, and just really go, okay, like, we've got this step taken care of, check. Now let's move on to that next one, and really just helping women just, like, walk through that and know what's going on, and at the same time working with them to manage I like to call them the dodgeballs that come out of nowhere, because you go see your doctor and they're like, oh, we are going to have you do this. We're going to move you to IUI or IVF. And then it's take back, okay, what do we actually want to do? Right? Because it does take us time to get your body back
Right.
into a space where it does feel safe, where we're going to see that lab work make some good movement, where that cycle is also going to feel safe to be on a regular schedule,
Right.
to, at the same time, maybe even come back if it's been missing. So just really trying to make sure that we wipe that slate clean and really figure out, what do we need to be doing? What's
Mhm.
realistic? What is the diet needing? And what things do we need to be working on? Because usually there's multiple things and
Right.
everybody's so different, right?
It
Giving
is.
someone like a blanket statement,
Mhm.
I can be really good at managing stress, but that doesn't mean that I'm eating enough in a day.
Right.
And so then my body is still underneath stress, but not a stress that I need to meditate on, and a stress that I need to prioritize feeding myself. Right. And so just really making sure that we are meeting that, or like if someone has like dietary preferences as well,
Mhm.
okay, like how are we going to work around those in a way that feels good to you at the same time, right? So
Right.
just making sure that I'm meeting them with where they're at too. So I would
This
say
is,
that's usually the beginning
yeah.
part.
This is a really important part, is like seeing this part, what people have done and where they're at in their journey, because this may look very different if you're at the beginning of your journey before you even have stepped in foot in a fertility clinic,
Mm,
or if you've been in a fertility clinic, you've done 4 rounds of letrozole and a couple rounds of
mhm,
IUI, and now you're looking at IVF. You're going to be in a different position, and you might
exactly.
need some different nutrition
Mhm,
and other stress support, because at that point stress is a huge factor. And so meeting women where they're at and really getting to this place is such an important support and supportive step. And I also wanted, you mentioned something about time. This is something
mhm,
that I feel like sometimes, this kind of going back to this idea that this is a dream fairy tale. We come off of birth control and we're going to get pregnant and it's going to be great. But then you have, when reality kind of sets in, when you start making those nutrition or those lifestyle changes, that takes time. I
Mhm.
mean, 3 to 6 months or more, at least from what I have seen.
Mhm.
Um, and that can really bringing that to the table and saying, hey, look, this is what this looks like. We can
Mhm.
get and improve your symptoms. We can improve your fertility and help your overall health now and in the future and support a future pregnancy, but it's going to take some time and being patient with yourself. There's no quick fix here.
Mhm.
There's really not.
We're Yeah, and we're stuck in a society where it tells us that,
Yep.
right? And it lacks the fact to like explain too. Like I always say, like all the changes we're making are making an impact, but the biggest impact we have is 3 to 6 months down the road,
Yeah,
especially when we're looking at the 90 to 120 days of eggs maturing.
exactly.
And it's just one of those things that that's why Mm, I'm not anyone who is a proponent of quick fixes because honestly, I believe what helps you get pregnant keeps you pregnant. And then
Yes.
what also helps you recover from this season of your
Mhm.
life. And all of those stages are super important for your nutrition. I think a lot of times in our fertility space or the PCOS space too, we get pregnant and we're like, woo, we're off the hook. Well, we're
But
not,
we're not.
right? Like pregnancy brings in different symptoms throughout. And I am a proponent of being proactive versus
Right.
reactive. So continuing to watch those labs so we can make any adjustments we need to ahead of time versus you finding out in your third trimester that you're diagnosed with like preeclampsia or you're diagnosed with iron deficiency anemia, really making sure that we're doing the things we need to do to mitigate those things and be proactive about those things and setting yourself up to decrease the risk of that postpartum anxiety and depression.
And
And
depression.
at the same time, just increase that recovery because most of the time, if one is on your radar, there's usually more
Mhm.
future offspring in your radar. And so a lot of the things we're going to do in your fertility space, you're going to have to redo them in
Mhm.
your second
Later.
space, but with a small child present, which gets a
Right. And which
little
is
it's a
even
new
harder.
piece of puzzle.
Right. You
So,
mentioned this like increased or understanding that yes, our goal may be right now to get pregnant, but there is so much more at play here. We
mhm,
know research has shown that you have an increased risk of miscarriage with PCOS, largely due to progesterone challenges and not being able to maintain that pregnancy. So lots of early pregnancy losses. And then we also know that gestational diabetes also
mhm,
is an increased factor as well. And then also development of type 2 diabetes after that, right? We know those. I mean,
yep,
these are all domino effects and things that we're
mhm,
looking at. So it's not just about getting pregnant, it's about getting healthy, having those healthy eggs, having the healthy uterus, the healthy womb,
mhm.
and then maintaining that pregnancy and then continuing your health to carry that pregnancy to term and then recover afterwards. Because let's face it, pregnancy is hard on your body.
Mhm.
It's
And I
so
think that
hard.
we forget too that, that even that postpartum space, especially if you choose to nurse baby, then like your needs are even higher. And that's even a
Absolutely.
more depleting time of your life than pregnancy is. And we're also trying to make sure that we restore your health for your long-term health in that postpartum
Exactly.
space, too, along with setting you up to have the next pregnancy with a decreased risk of complications. Because I'll tell you, every pregnancy is so different. With working with women through multiple pregnancies, your first pregnancy is not going to be how your second pregnancy
Nope.
is, nor your third. They're very different pregnancies. And so they all need to be taken within the same focus level that you have during that fertility space. And that's just, like you mentioned, Corey, like the fact is like a lot of times those labs aren't being pulled. Like I
No.
see constantly where progesterone isn't being pulled at the beginning of pregnancy. And have clients continue to advocate for themselves to get in that office and get those HCG levels checked, get that progesterone
Mhm.
checked, just in case we need extra support in that space,
Right.
right?
And the
That
timing of those,
doctor has the
yeah,
key to do it. So,
yes, and that timing
um,
of those
mhm,
levels is important too. Like we, your because your levels change throughout your cycle. So just going in on a random day may not give you the accurate picture. This is why it's really important to work with somebody who specializes in, root causes and also understanding these very intricate details about your hormones, especially that point if you've experienced pregnancy loss, getting those progesterone levels checked because that is one of those things that can be supported with with progesterone to help maintain that pregnancies, but you wouldn't know if you don't have the labs, if you don't have that
mhm,
information. And yeah, it changes every time. So what might have worked before may not work now with different
mhm.
pregnancies. If you're experiencing secondary infertility, those things are challenges, and this is why individualized care and individual plans when working with nutrition and lifestyle is so important.
Yeah, it's incredible to the lack of seriousness. Like the number of times that you have to experience a loss or the length of time
Oh,
you have to not have a positive test before the medical system changes how they support you. It's been something that's been very eye-opening on my journey of supporting women in their fertility journey. Is I mean, every state is so different.
yeah,
And every provider, even within the same state, is so different. And it's just incredible just to see those differences. And unfortunately, sometimes that, well, you've only had one loss. So,
right.
and it's like, that's not just one loss. Like that's a huge impact on someone's life. Like that's a dream. Like that's a future built before. Like there's so many things that it just hurts my heart when I think
Yeah.
about the lack of serious sometimes that is taken to support women after they've had that
that's
loss.
that's one of my personal passions is looking at these aspects, these emotional aspects, the mental toll, the stress, and the emotional taxation, as well as the taxation on the relationship that happens. I mean, which increases stress, and seeing that you are a whole person. You're not just a body here that's trying to get pregnant. You have feelings, you have emotions, and these are very deep seated things that will stick around, and they will not
Mhm.
just go away even with a pregnancy, and that is so important to understand. And so bringing that compassion and understanding, and really, I kind of made it my mission to get this space, um to see, this healthcare space, to see the emotional component, to see the compassion component of our healthcare in how we're providing those services. Because honestly, as a nurse, when I was working in the hospital, literally it takes the same energy. You're there,
Mhm.
so you're not, um it doesn't take a whole lot more. You're already there, you're already spending time with them to acknowledge that this person is going through something. So I'm a huge advocate for that, and I'm so glad that you mentioned that, because it's something, especially on the fertility journey, like this is a really tender place, that's
And
filled with a lot of heartache and a lot of loss.
yeah, and I will add, like it is unfortunate that it's not even there's so many great providers that I know that are underneath pressure of
Yeah.
just our systems.
Yeah.
And so one of my biggest things is like making sure that every one of my clients has that time. And that we process through the decisions that they're making because you may not, I would say 98% of my clients don't get that in their physician's office where they're actually getting the time to ask the questions,
Yep.
process through the options, weigh the pros and cons, and then talk to their significant other, come back with questions, right? And so just making sure that you like that people have that space to really process and figure out what is right for your journey with the options that are laid out. is super important. And to kind of, remember too, you can push back, you can ask questions as well. You don't have to just go down the pipeline that is being
Sure.
recommended. You can
Yeah.
ask, like, what are my other options? And really advocate for yourself in that space. And I think a lot of times we get told one pathway from a doctor, um, and we're not aware of that there's other options out there too. So
One of the biggest things that I like to tell people is asking the question, is this applicable to me?
mhm,
Is this medication, why are we prescribing this medication based on my personal history? Or, is this path the best for me? It really brings them back to this place of patient-centered care is,
mhm,
individual, and it gives them power back. It gives the patient, the client, power back because they feel like, hey, you know what? I am an important piece of my healthcare team. I mean, and honestly, I believe the most important piece, and because it's your body, you're the one
yep.
who's doing it.
Yep.
So,
I always say, like, even when it comes to even to with food safety and pregnancy, like, there
yeah.
are like statistics and there are things, but your instinct is something that you need to listen to,
Mhm.
because that is just something that you just can't override how
No,
well that instinct can play a role into protecting you. Like, your body was made to do that. So
don't
yeah,
ignore it.
I'm
Mhm.
firm believer in that as
Yeah,
well.
listen to your body. Your body knows. Like, teaching this, like encouraging this is so important. Is it your body will tell you so much information. It's something that I just absolutely love talking about because it has this um it's not all just super woo woo either. This is very like your body has language, it has ways to communicate with you, and if you start paying attention to those things, how your GI affects, how do you feel, how do your joints feel, do you have headaches, these kinds of things, this is your body talking to you. And when you start to pay attention and support your body in the way that she needs supported, then suddenly it works much more smoothly. And
Mhm,
it's amazing
mhm,
how that works. So um I I think that it is there's one thing I wanted to talk about, and that was about those that are facing and tackling health challenges with difficult socioeconomic situations.
mhm.
We know that statistically, lower class, lower income families tend to have higher chronic illnesses and PCOS, especially in those racial disparities and racial and cultural, or excuse me, ethnic groups that have more higher of an incidence of PCOS. So, what um, what can we do, and how can we give information to those that might be struggling with their finances to be able to support their health? What would be some things that you would recommend to help them with that?
One I would say is it is a tricky one, because at the
It
same time I
is.
would say you kind of have to sit back and really decide priorities, which I
Yeah.
know is like it's a hard thing in figuring it out when there's a million things being thrown at you of what's the best thing to be doing. But I at the same time, that is where I'm very big on, like, you meet people with where they're at, and remember too that you get have the power to make the best choices for yourself. Sometimes you need to throw out a lot of those mainstream, and just from a nutrition lens, nutrition like messages, like, if
Mhm.
you sometimes have to make the best choice with what's available to you, along with what fits in your budget. So, remember that the fact is at the end of the day, like, frozen fruits and veggies are great choices. They
Yeah.
don't have to be fresh, right? Like, you don't have to. They last longer. They're more sustainable.
Right.
They're more economical. Canned fruits and veggies
Mhm.
too are a great option. So really looking at, like, what is the best for you, and at the same time, like, what are you actually going to eat? I mean, a
Right.
lot of our food connection is from what we were raised on.
Yeah.
Um I like if you give me some fresh peas, like I'll probably, it takes me a little bit to eat them because I was not exposed to that. But if you give me canned peas, I'm there all day. You
Opposite.
know, yeah, and that's what I was like exposed to. So to me, like those taste buds are formed at such a
Yeah.
young age. And so
Hmm.
at the same time, you have to lean into those things. Like there's no point for if you're not going to be in a space to like if you're never going to touch the I'm just going to use the frozen peas as an
Sure.
example.
Yeah.
Like if you're never going to touch those, but you're going to eat 5 cans of the canned peas, like you're
Then eat
going
the
to
canned
get the
peas.
nutrition, right? Like
Then
this
eat the canned
nutrition
peas.
that's sitting in your freezer is not going to get in your body when you keep
Exactly.
bypassing it until it gets freezer burn, you throw it away. So really remember, like, one, look at things as in what, like, how can I make the best choice based off of what's available to me? One, because not every store has a lot available either
Hmm.
in different places you live, but then at the same time, like, what will I actually eat too?
Yeah.
Right. And what fits into my budget. And so, really making sure that we're looking at it that way to really be supporting that because like I said, like the research doesn't show that you have better health outcomes if you eat organic fresh produce all the time. The research shows that if you eat fruits and veggies on a regular
Then,
basis, you have better health outcomes. It
right.
doesn't matter the form of them. So just remembering those things as
Yeah.
well, and that goes into other products too. So
Sure.
just remembering to really understand that making that best choice of what fits for you and your family is super important. And hopefully that takes off the stress as
Yes.
well when it comes into that grocery store,
Yeah.
grocery shopping experience. So that's one thing I would say is just really trying to like maximize to just like that grocery budget. So that way that's not something that's really impacting just like your finances too because I know
Right.
that that can become really overwhelming
Yeah.
um and so I would say that, and then just really finding, you know, a provider who's also going to meet you with where you're at and
Yeah.
having them be like helpful. And then don't hesitate to connect to other resources. Like
Yeah.
don't hesitate to use like a food shelf, a food pantry
Right.
space to subsidize some things. Depending on what state you're located in, there's a lot of other types of programs too that really help put fruits and veggies and even meat and all those great things on your table too. So don't hesitate to like reach out to those different types of programs to also just kind of help within that space too. And if you need, you know, help in other resources as well, like, you know, healthcare, it's really great to reach out to your different like counties and cities, wherever those resources are kind of hubbed in your area. A lot
Right.
of times they're hubbed at the county, but just trying to go through that process and have like reach out for help, ask for help, have someone
Yeah.
help in you. And you know, at the same time, if you need help, I could probably find it, so don't hesitate to like just DM me, say like, hey, I'm located in this city, this state, I'm needing help with finding resources.
You're like,
I
I
will
got
help
you.
you find. Yeah, it will
Need
take me
help?
not
Message
that
Amy.
far, so
Yes. Well,
you know,
that's,
so
yeah.
I think anything you would add to that, Corey, because I think that that would be my top things, really.
Sure. I think one of the biggest things that I love talking about is kind of the stress component. I mean, the
Mm-hmm.
nutrition is so important. And you hit on so many of those great points. Um, I feel like there's so many things that we can do that don't cost money that can
Mm-hmm.
support our health. And some of those things is like sleep. I know
Mm-hmm.
that that is a huge, huge component is getting enough sleep. We should be
Mm-hmm.
getting 7 to 9 hours of sleep a night. Some of us need that upper end, some of us need that lower end. But
Yep.
really, in order to get our bodies really ready for sleep, we should be shutting off those phones an hour before or having blue light filters so that way we're telling our bodies, hey, it's time, turning down the lights. And then also on the other end, in the mornings, not jumping right on the phone first thing in the morning because that triggers. I mean, I like even the alarm clocks in the morning. It's interesting the amount of stress and how well my mornings have gone when I switch from doing an alarm clock to my Fitbit doing a
Mm.
buzz. Um,
Mm-hmm.
but just like understanding that the culture that we live in right now is so stimulating. And so doing what you can to reduce your stimulation by turning off the TV, turning off your phone, sitting and breathing for a couple of minutes, taking a walk outside at your local park in nature, like these things are things that don't cost a penny. They don't cost a cent,
Mhm.
but they will do these parts. It's all these multifaceted, these components that will help support your health. Is it going to make magical like things happen immediately? No, but this is in combination with things like making sure you have more fruits and vegetables, making sure that you get, proper sleep, nutrition, and, maybe getting a supplement or two that would be the most impact for you. Like
Mhm.
this is how you get yourself in track and get you meeting you where you're at, like you said, meeting you where you're at and getting you somewhere on the path of wellness. So yeah, this has been so fantastic, Haley. I am so glad that we've been able to talk about all of these amazing subjects about nutrition and fertility. For those of you that are listening, Haley has an amazing resource that she is giving to you for the summit. Is called the Top 3 Insider Secrets to Managing PCOS Symptoms to Get You Pregnant. So this is an amazing resource. It's free. So I'll make sure that I attach the link here underneath the video so that you can get that. Of course, Haley's available on socials. I'll post those here as well. What's the best way to get a hold of you, Haley, if people have questions or want to work with you?
Honestly, it would be just reaching out to me on Instagram at prenatal.nutritionist. That's the easiest space to find
Okay.
me, and where I'm at all like present continuously. And then, but if you don't have Instagram, just reaching out to me on my email at haley@nutritionwithhaley.com. That would be the second way to get to me as well. So
Excellent. Yeah, that's
don't
fantastic.
hesitate to reach out.
Yeah, please. She's a wealth of information and definitely somebody that having on your team is really important. So if you have questions and how she may be able to support you as a registered dietitian, please don't hesitate to reach out. Okay. All right. So Haley, as we wrap up here, I would love to ask you one more question before we head out. What is one thing you would say to a woman with PCOS trying to get pregnant that could bring her back to joy and wholeness right now?
Gosh, that definitely throws me for a
I
left
know.
curve almost. But really I would say that at the end of the day, like keep advocating for yourself and remember that you're doing a stellar job and remember that you are an amazing person. And I honestly would love if you added something into your schedule that does bring you joy, that does fill
Yes.
your cup. And so write down some things that brings you joy and bring those into your week, if not into your daily routine. Because when we fill our cup with joy in those moments that bring us joy, it really creates us to be resilient and it really mitigates that stress that this journey can bring to us.
That's amazing. Bringing so much joy and happiness into your day is such an important aspect. So, thank you so much, Haley, for that. And it has been an absolute pleasure. And we look forward to connecting with you and the listeners connecting with you soon. So, have a wonderful evening.
You too. Thanks, Corey.